What's up, Doc Mike? Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for February 18, 2021. Is it safe to reopen U.S. schools during the COVID-19 pandemic? Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Thank you so much for joining us for Schools Week. And in today's final episode, Dr. Josh Sharfstein talks with Dr. Caitlin Rivers about the science behind reopening schools, what data districts need to consider, and the measures that can help reduce risks to get kids safely back to the classroom. Let's listen.
Dr. Rivers, thank you so much for joining me. I know that you have been looking in great detail at this question of COVID-19 and schools. And so let's start with an easy question. Is it safe to open schools?
I think that schools can be made safe, but they are not inherently safe. And if we think a little bit about what goes into making schools safe, I think there's a few big elements. One is community prevalence. What is happening in the community? In places where there is a lot of viral transmission, it will be more difficult for schools to be safe just because there will be so many introductions of cases into schools. The second important bit is how we act in schools and what mitigation measures we put in place to prevent transmission among the people in the school building. And these are all the things that we're all familiar with now after a year of implementing them in our own lives. Masks, distancing, testing, I think is a big one, pods, particularly for younger children. These are all measures that can help to reduce risk in school buildings and I think can help to get kids back in the classroom safely.
So let's maybe take each of those in turn. So the first is the level of community transmission. Where does the data fall in terms of how much virus in the community makes it concerning to even try to open schools?
There is, I would say, adequate convergence on what thresholds or what epidemiological indicators we look at to understand the risk to schools. CDC has a nice table on their website that lays out a few suggestions, but I think the take-home message is that their highest risk category tops out at 15 cases per 100,000 per day. Some people may go up to 20 or 25, but it's generally in that range where schools are thought to be safer. We here in the United States are currently around 46 cases per 100,000 per day, so well above the recommended upper threshold. But the good news is that we are coming down that mountain. Just a month ago, we were at 76 cases per 100,000 per day. So we are headed in the right direction. And I think that bodes well for school reopening.
Got it. I mean, I remember when the conversation was first starting, some people thought it might need to be 3 or 5 per 100,000. And it sounds like you're saying over time, the evidence on transmission and the experience of other school systems that have opened has pushed that number up, but it has an upper bound.
I think when we talk about what is safe, it matters a lot how we incorporate mitigation measures. If you are down around 3 cases per 100,000 per day, maybe you would want to keep the masks, but you could do away with some of the distancing or do away with some of the cohorting. As you get up into higher levels of community prevalence, you really need to layer on more and more mitigation measures in order to continually reduce that risk. It's really a sliding scale.
Got it. So let's talk about the mitigation measures. Let's say that there is a reasonable amount of community transmission and you're in charge of reopening schools. What are the kinds of things that you would want to see in place?
I definitely recommend universal masking. So that means masks both for teachers and children. I know that it can be hard for some children to wear masks all the time. They're not always compliant, but I think the experience of schools that have reopened have shown that children can learn to wear masks. And I think that's a very effective mitigation measure. Distancing, keeping kids apart by moving desks apart, by marking places on the floor where children can stand. This will be helpful. Cohorts where children only contact their classmates and don't move between classrooms is also quite effective. I think all of those three mitigation measures are relatively easy to implement and useful. The big lever, though, that not a lot of schools have brought to bear is testing. The evidence is quite strong that testing once a week, or ideally even twice a week, is very effective at reducing risk of transmission within the school building. And so I think that is a big area for growth to help make schools safer.
Got it. And if that kind of testing is available, do you think that makes it possible to open schools with higher community transmission?
Absolutely. I do think that testing buys flexibility in terms of community prevalence. So maybe instead of looking at 15 or 20 cases per 100,000 per day, you could go up to 30 cases per 100,000 per day. The exact thresholds have not been well enumerated, but you can push that ceiling up with regular testing.
And there are some schools that have been able to do that kind of testing with the viral testing, the PCR testing, but there are other technologies not too far down the road, perhaps, that might be easier for more schools to access, do you think?
I think antigen testing is the big opportunity coming down the road. Antigen tests are already in use, but for various reasons, they have not been super accessible to schools, and I think that will be changing. In the coming months, we will be seeing a lot more capacity in antigen tests. There will be tens of millions of tests more on the market than are available now. And I think there will be, hopefully, more regulatory flexibility. Right now, many of those tests are not authorized for children, not authorized for people without symptoms. And that's something that we may see change in the coming months as well, which would make them more accessible to schools as well.
Sure. And maybe there'd even be more evidence that would show how well they perform under those circumstances.
Yeah, that's the big gap that's preventing authorization in children and people without symptoms, is there's not a very strong evidence base for how those tests perform. But as we're able to grow that evidence base, we'll get a better sense of whether that's an appropriate use. And I think the early evidence suggests it can be done. They are not as accurate as PCR tests, but if used regularly, they might be accurate enough to reduce risk meaningfully.
So if you were to take your recommendations on opening schools, you have to have a reasonable amount of community transmission. You can't have too much. You need to have mitigation measures in place. You're to look out on the United States where there's been a range of practices. You would probably be somewhere in the middle. There are some school districts that are kind of following what you're doing. There's some that have opened wider at higher levels of transmission. There's some that are still closed despite, being able to do the things that you're recommending. Do you think that the evidence of their experience backs up your perspective on where to draw the line?
The evidence around transmission in schools and around transmission among children is really murky. And I think this is what has made schools such a difficult topic. It continues to be the case that they often do not have any symptoms at all. And if they do have symptoms, they're quite mild. And it makes it really hard to understand what transmission looks like in children. We know when we look only at symptomatic illness, there's usually very little evidence of transmission in schools. But when you dig a little bit deeper, I think there's some things to be concerned about there. When we look at serosurveys, which look at evidence of prior infection, we see that children are infected at rates similar to adults. And so that suggests that there's more happening kind of underneath the surface than we're able to see. There have also been some interesting studies that regularly administer PCR tests to children, particularly those who have been in close contact with someone who is infected. And they, again, find that children are completely able to be infected and transmit to others. It's just somewhat hard to detect and maybe a little bit less frequent. But I think these lines of evidence taken together suggest that we do have reason to continue to be careful about reopening schools. They can be made safe, but I would say they are not inherently safe.
So what about the variant of the novel coronavirus? How does that development change the situation for schools?
It's something to keep an eye on for sure. We have seen the B.1.1.7 variant, which is the variant that was first identified in the UK, has made it more difficult for multiple European countries to keep their schools open. Several places have moved to close schools after committing to having them open through the winter. And so I think that it may be a challenge that we face. Right now, we know that variant is circulating in the United States, but does not constitute a big fraction of cases. So it's something to watch, but is not currently, I think, playing a big role in school reopening decision-making.
So is that something that should affect decision-making now, or is it the kind of thing, make your decision to open, see what happens, and if you get a lot more infections than you were expecting for the level of precautions, then everybody needs to take a timeout?
The way that I'm thinking about it is that B.1.1.7 is something to worry about. but it is not currently, as far as we know, really playing a big role in what's happening in our communities. If that starts to change, and if it becomes the case that our caseload is rising, that there are more outbreaks in schools, then we would have to reevaluate. For right now, though, it's something that we're just looking around the corner at and not something that is currently kind of front of mind with decision-making as of today.
Got it. And what about the actual experience of districts? Have you seen that when districts open too much too quickly, that there are in fact outbreaks and problems, say, with teachers getting sick?
There have been many documented outbreaks in schools. Thankfully, they are generally quite limited, although, again, I think there may be more happening underneath the surface there than we see. But on average, I would say the experience of school districts that have reopened with those mitigation measures is very encouraging, and I think bodes well, again, for school reopening.
Got it. What would you say to people who are nervous about the unknowns of school reopening and are worried that maybe we don't fully appreciate the potential danger?
It's true there are unknowns here, and this is a particularly difficult area of policy because we care a great deal about children and educators and keeping them safe and healthy. But we have also seen that over the last year, it's been really hard on children to not be in the school building. And I think balancing these competing priorities is really tricky. I can say for sure that even for children who have the opportunity or the option to go back in person, some will choose to continue remote learning, either because they are not comfortable, their families are not comfortable returning to the classroom, or because they have an underlying health condition that makes it inadvisable. And so I think as we move towards school reopening, a return to in-person learning, we also need to continue to commit to making remote learning equitable, accessible, effective, because there will be some fraction of children and educators who will need to continue online.
Got it. And now we have vaccines. How do you think that changes the sense of what the right thing to do for schools is?
The good news is that many states have chosen to make educators among the first people to be eligible to receive the vaccine. And I think that's a really great option for protecting teachers and staff and making sure that they are safe to return to the classroom. Definitely support that as a priority. One thing I think it's important to remember, though, is that children under the age of 16 are not authorized to receive the vaccine. And so schools will still be susceptible to outbreaks because we will still be bringing together 1 or 2 dozen children who are vulnerable into a classroom. Although kids do not experience severe illness on average, the concern would be there would be an outbreak in the classroom and they would bring the virus home to their families. And those households may have people who are vulnerable. And so I think we should proceed certainly with vaccinating educators, but also need to continue focusing on making schools safe.
So if there's a lot of virus in the community, then we still need precautions in schools, even if all the adults are vaccinated.
I think we will need precautions in schools for quite a while, in fact, because there are no vaccines right now available for children. On a societal level, the vaccine will reduce community prevalence, and so it will indirectly help with school reopening. I just don't want it to be the case that as soon as teachers and staff are eligible to get the vaccine, that we slow down on mitigating transmission in the classroom. I think we need to continue to keep it up.
So there are some funds that are becoming available for schools as a result of legislation that passed at the end of 2020. There's a lot more being requested for schools in the latest Recovery Act proposal from the Biden administration. Do you see the big investments coming as helpful to the cause of reopening schools?
I think so. All of these mitigation measures cost money. They're very expensive for schools that may be accustomed to running on a shoestring budget. And so if we want schools to be able to improve ventilation, to have additional cleaning, to provide masks to people in the community, all of those things cost money. And I think that we do need to be ready to support those schools in reopening, particularly because this has to be one of our society's top priorities. Getting kids back into the classroom safely is a priority really across the board. And so we need to fund it accordingly.
So you see the science to support reopening with reasonable levels of community transmission and precautions, and hopefully the funding that can make a lot more school systems ready to go.
That's right. I think there will be many more opportunities over the coming semester than there were in the fall to reopen schools safely. Just want to make sure that we maintain those precautions and ensure that our children and our educators and our community at a whole are protected.
Well, thanks so much, Dr. Rivers, for joining me to talk this over.
Thank you for having me back on.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.